So I am extremely thankful to Dr. Virendra Singh, our Director of Punjab Institute of Liver and Biliary Sciences, and Dr. Janvi and Dr. Amandeep, co-organizers, for bringing together a galaxy of experts on ascites and liver disease, liver and pancreatic disease. You see, Punjab, as my friends from PGI will bear with me, that it's an agriculture state, and Punjabis, they love three things, that is desi daru, alcohol. They are very fond of alcohol, and badam and desi ghee. So possibly the latter two things are not bad, but the alcohol is not so good. So they take a lot of it. So we have a lot of alcoholic liver disease. And to add to the problem, we have a lot of hepatitis C and B now. And there is a problem of drugs also. I think this is a global problem, but Punjab is one of the worst affected, so is Haryana, and other states are getting involved. So I think it's a global epidemic, and there is also a global epidemic of obesity also. So I think we have learned hospital management, we have learned business management. I think weight management is still a tricky situation for all of us, including medical personnel, and it's not taught as a discipline. So as a result, we have not only alcoholic liver disease, we have non-alcoholic cirrhosis also, which is on the rise. So the burden of cirrhosis and hepatobiliary and pancreatic cancer is on the rise. Now, when we are discussing ascites, when I was medical student, though I went on to become an eye surgeon, but ascites was like a mystery that time, but now the diagnostic tools and the knowledge, that is where this conference is important, because then now it's with Dr. Paulo Angeli and a lot of, I see a lot of names which are mentioned here, which Dr. Virendra Singh has mentioned. It's a global meet on ascites and hepatobiliary and pancreatic cancer. So this will significantly contribute as our government, for the government of Aadmi Party or led by Bhagwant Mann and our national convener, health is the topmost priority for our government. And we are taking initiative to address it at the primary levels, country level and the tertiary level. So that is where I am here to seek your support, how to strengthen for capacity building. How can your expertise and your knowledge can reach somebody in the Aadmi clinic or Mohalla clinic in the village? How can we work together? We have various initiatives. Sir, first is the Eat Right initiative. If you eat right kind of food, if your food is organic and you take millets, more of vegetables, more of fruits, so you are likely to be more fit. Then we have introduced yoga in all the cities. So dietary, nutritional guidance, Eat Right initiative, and yoga. These are some of the interventions which we are making, and a playground in every school. So more of physical activity, because with this increased mechanization in Punjab, the life has become sedentary and our diet has become more of the processed food, and you see that is what is leading to non-alcoholic liver disease. So our government is trying to address it at the primary level, and then the secondary level is the early diagnosis and the treatment. That's where I found that there should have been many more doctors from Punjab, and I will possibly send them. DRMs have called them tomorrow. If they are not come voluntarily, I think they should have enthusiasm to learn, all the doctors. So we have already done it for cardiac and you see for stroke also. We have a hub and spoke model. That's what I propose for liver diseases, where PGI and our Punjab Institute of Liver and Biliary Sciences can be the hubs, and the entire of Punjab can be the spoke, all our district hospital and sub-division hospitals. So our STEMI project, that's the ST-wave elevated myocardial infarction. So we provide that inactive phase injection even in primary health centers and community health centers, where the patient is thrombolized, then shifted to a tertiary care hospital for revascularization in time. Similarly for stroke, We have again provided, the thrombolysis in the primary care and the secondary care. Then the patient is shifted to tertiary care hospital, which in this case is CMC, PGI, few private hospitals also. DMC has started mechanical thrombectomy. So similarly, I think we can work together for knowledge sharing and hub and spoke manner for liver disease also. I think we have to go right up to the village to educate people, and then early diagnosis, because if we are talking about ascites or hepatobiliary and pancreatic cancer, we are treating the disease at the terminal stage. We have a lot of CKD. So the reason was that hypertension and diabetes, they were either not diagnosed or not properly managed. So with the 881 Aadmi clinics, so now their hypertension and diabetes are being diagnosed early. We are working on alternate, therapy, in this, which I have already elaborated. So now these diseases are being managed. Otherwise, the disease burden is too much. We have so many dialysis centers. So with many NGOs, I have close to now 181 dialysis machines working day and night. But still, there is a lot of demand, and there was a study conducted by the AIMS that most of the people, they slip below the poverty line because of out-of-pocket expenses on health. So we are trying to address that issue also. So I'm sure that your conference will show us the way. It will help us. This should be the beginning. And then we can send our doctors to Punjab Institute of Liver and Biliary Sciences, and Dr. Vrinder Singh is already working on that, and we can send our doctors and paramedics also to institutes like PGI and AIMS, which we are doing for drugs. That's how we can progress. I wish success to your this conference, and I wish that you will have very useful deliberation, and then at the end of the conference, you will give us guidelines how to manage the liver disease, not only in Punjab, I would say northern India. We should lead by example. And last but not the least, in the whole of India, I think it's a global problem, air pollution. It's not discussed in the parliament, it's not discussed in any of the assemblies, but I think it's killing us. This may partly be responsible. And food toxicity, again, it's not discussed. So any chemical that goes into body, I understand first it goes to the liver, what is called as first pass effect, if I'm not mistaken. Whatever goes out of the liver, it goes to the brain, and wherever it's therapeutically needed, even all the medicines, all the Ayurvedic medicines, and there are a lot of chemicals in our food. So air is polluted, there are issues of water pollution and microplastics. You are all using this bottled water. I'm sure there is some microplastic in it. So there is a lot of evidence to do that. But this is again a modern life problem, and we have to discuss all these issues. How can we protect our liver? How can we work together? How can you help the state government in capacity building? So that we are working day and night for Rangla Punjab, very healthy and vibrant Punjab. I'm sure for vibrant India and for the vibrant world. I am not surprised that there are few people in this hall, because wise people are few. They are not many. So, but they are enough. Even if the numbers are not high, but their wisdom, that light will spread. Actually, this is symbolic. The light we have lit, the light will be lit here, and it will spread to the entire medical fraternity, then to the general public. And together we will overcome this epidemic of obesity, epidemic of liver disease, and so many other lifestyle disorders. I wish you all the very best, and I wish a very pleasant stay. And for our European friends, I think it's quite, the weather is very hot for them, so they have to be careful. They can enjoy the city beautiful in the morning and evening, and I wish them a very pleasant stay and a very fruitful discussion. Thank you very much for giving me this opportunity, and wish you all the very best. Have a pleasant day. Thank you very much.
Thank you, sir, for your words of wisdom and encouragement. Now I invite our co-organizing secretary, Dr. Amandeep